That's the main thing here. Okay, come now endotoxins. Endotoxin, exotoxin, same story only. Okay, we remembered very well. We always say endotoxin and exotoxin. Exotoxin, right? Exotoxin. Always I told you endotoxin means you draw a small house and put a guy inside. For exotoxin, you draw a house and put the guy totally outside of the house. Okay, and outside of the house you have a sunlight, right? You have a heat. There is a heat always. Now it's summer, so heat is there. So what happened? This guy exo is basically an extrovert, right? Extrovert, active guy. Intro is an introvert. Indo is basically an introvert guy, right? He's very shy. He's at home, right? He's inside the home. So the extrovert guy is active. So here is sun, so he gets labile. When he goes out, he gets labile. Here he's inside the house, so he's stable. So heat is stable. He's very heat is stable. But unfortunately, what happened? He's inside the house, so he's a lazy guy. So because of lazy, he get lipid, lot of lipid in his body. That means to say fat, and he's totally negative guy. He's totally negative, means gram negative. Okay, he's negative guy. So no immunity, no proteins. He's not taking any protein. So he always lipid, no protein. So no immunity, no immunity. You know the story very, very well. But this guy is active. He's going outside, playing games. That means he takes lot of protein. He takes lot of protein. His immunity is also well built. Okay, well built. Only problem, sun labile. Okay, that's all. This story we know very, very well. Now you can answer me. Endotoxin is produced by, of course, only the gram negative. So endo negative people. Okay, they are always negative people. Endotoxin people who stay inside the home, they are very, very negative. So which one? Gram negative bacteria, and we're talking about LPS layer. I said lipid because lipopolysaccharide. Lipopolysaccharide layer is present only in your gram negative. Okay, first question. That's basically lipid A content. LPS is basically lipid A content. So endotoxins are usually non-specific. They don't have any specific role. So they usually cause all they activate all the inflammatory mediators and cause all the non-specific reactions like vasodilation. You can say vasodilation, your fever, malaise, even most important sepsis. Your sepsis. These non-specific non-specific reaction, inflammatory reactions happening because of your this thing only. Okay, right. Now, you know, treatment is what? Treatment, you will non-symptomatic treatment only. Symptomatic treatment, like example, you have to decrease the temperature, you give what? You give one of the paracetamol. Example, I'm saying paracetamol you give, so it inhibits the temperature. Okay, because you have fever and everything. No, you have fever, sepsis. So all the non-specific symptoms will be shut down. That's all. Okay, this is for your endotoxin. Exotoxin is very, very, very specific. Exotoxin, we'll talk about it. I think there is other upcoming slide. We'll talk there. So they are very specific. Like example, cholera toxin is separate, and we have it is both gram positive and gram negative. Okay, you know that this is for both gram positive and gram negative. Both are having this. Yeah, both are producing your exotoxin, cholera toxin, diphtheria toxin, all those examples. Okay, we'll talk that in upcoming class. Okay, no problem. Now you can go. Growth curve. Yeah, we talked it. I don't know. I think I don't mind going again. So phases we told about: log phase, lag, log, stationary, death phase. We discussed enough. Now no need to do anything. So here is this question you see. They said uniform staining happened. I told you where in microbiology lab during which phase? During your log phase. When you're active phase, they will send you to the microbiology lab and teachers will tell you staining, AST, biochemicals. So biochemicals, staining, AST. See, you got it. So this is what they're asking. Okay. So this all happens in your log phase only. Okay. Log phase. That's all. Okay. So don't forget biochemical test, staining method, and AST. You will do where? In log phase, in college phase. In college, in microbiology lab, you will be doing all these things. Remember like that. It's easy. Okay. That's all. Okay. I'm not going to stress again. Immunity types also very, very easy. You know that. So we have natural, artificial, again acquired, active. Natural, acquired means any infection, after infection. After any infection, we get immunity. So that is the natural acquired. Okay. When you talk about artificial acquired means you are giving a vaccine. You give a vaccine and artificially we acquire the immunity. Okay. That is artificial acquired active immunity. So, okay. Our body active means our body should produce. Our body should produce immunoglobulins, antibodies. Okay. It produces the antibody. So passive means not our body. We give from outside. We give from outside. It's coming from outside. It could be natural. Natural means you're talking about mother to child. Mother to child immunoglobulin, especially we're talking which IgG we are talking, right? So that one, that is your natural acquired. When you talk about an artificial acquired, we are directly giving the immunoglobulin. Immunoglobulin we're giving directly. Example, which one? Example of TT. Example, I'm saying antisera. Antisera of TT, diphtheria, rabies, all these antivirals will come artificial acquired passive immunity. That's all. Okay, this is this is very basic. You guys know it. Okay, so I'm not going to stress. Okay, either after infection means natural acquired, after vaccine artificial acquired, and natural acquired is from mother to child. Naturally it's coming, or naturally I'm taking immunoglobulin. Okay, that's all. This is easy. Antivirals, different type of antivirals you're talking here. Fine. Okay. Now type 1 hypersensitivity reaction. Yes, we're going to talk back also. Now also you know very well. So you know, repeatedly asked question, when you talk type 1 means it's allergic. You know, it's allergic or anaphylactic hypersensitivity. Allergic or anaphylactic hypersensitivity reaction. You know this one. Main things involved here are IgE. Yes, it's given here, IgE or eosinophil mast cell. These are the few, and histamine. These are the few words frequently come in your type 1. Eosinophil, mast cell, which releasing histamine. These are the few frequent things you will cover. This one I no need to tell only. You already must be thorough with this. Yes. So granules released from the mast cell. Same thing. This only. All this lysozyme, etc. Lysozymes and etc. Histamines, histamine. All these allergic reactions which is coming. First exposure, you know, that's usually called sensitization phase. Always sensitization phase, where everything gets sensitized, and repeated, when the repeatedly allergen comes inside, you have effector phase. Okay, effector phase. That's fine. So same thing, mechanism is first sensitization phase, your allergen goes and attached to the mast cell, and mast cell gets sensitized, right? Mast cell gets sensitized. In effective form, when repeatedly if antigen is coming, your mast cells start to get sensitized and it start to produce all the histamine and every mediator, important allergic mediators. And so you will be getting allergy, right? Allergy, that's all. That is the mechanism. Not much you know significantly. Yeah, the most important thing, you know, the reactions. You know that, what are they? We're talking about bronchial asthma, any allergic disease, any allergic rhinitis, your anything, rhinitis, any allergy in your body comes, okay? Those things comes under this thing. And of course, the test, Cassoni's test. Cassoni test is a repeatedly asked question for hydatid cyst. Hydatid cyst, okay? That's all. This two you remember, basically, this will be the repeated question. And of course, all your helminth or helminth infection, any parasitic or helminth infection, parasite or helminth infection. That's it. This much only, okay? This is for your type 1 hypersensitivity reaction. Repeatedly spoken, not much to say. Okay, this and all, definitely by this time you guys must be having it in your pocket. So there's a few things in immunology you have to know. CD markers. So CD marker for lymphocytes, if you talk B cell, T cell, NK. Okay, please write it. This is very, very important. You can have questions here. So B cell, we know B cell means big number. The number should be big, not as big as NK, but big. So remember CD 19 to 23. This will be the for B cell. T is little bit small. That is, it starts from CD 1 to 8, especially CD4, CD8. You remember, no, CD4. Naked, this we already told. We talked a little bit. NK cells, natural killer, 1656, little bit bigger. Okay, CD 1656 is the main bigger. Rest are in small range. Okay. Now types of RBCs you form here. Here we are using the EAC rosette. You get a EAC rosette. This is basically erythrocyte. This is called erythrocyte. Erythrocyte, I'm sorry. 1 second. This is erythrocyte antibody complementing. Erythrocyte antibody complementing rosette we call. Here we call it as simply, 1 second. Sheep. We use sheep RBC. That's all. Here it's erythrocyte antibody complementing RBC. Here it's a sheep RBC. The rosette is basically because of this thing only. Okay. EAC rosette and sheep RBC rosette. Okay. We call it as rosette. That is the type of RBCs we are using. They can ask question from here. Here nothing. Natural killer is nothing. Now what are the subsets? Subsets of T cell, if you see, you have CD8 which is killer and CD4 is helper. Okay. One always help in which one? Type 4 hypersensitivity reaction, but 2 is 2 only. 2 is 2, nothing. 2 is helping, T helper 2 is helping type 2 hypersensitivity only. T1 is helping in 4 hypersensitivity reaction. That's all. This is a small thing. I just want to bring it here. We talked about it. EAC rosette, sheep RBC, CD kill. This little bit tricky, but you should know. Okay, get it. Yeah. Next, graft is super easy questions. You know this very, very well. I don't want to. Okay. What are the graft types? You know that the graft types are usually we have autograft, and then we have allograft, and then we have isograft, and then we have xenograft. The most dangerous one is xenograft. Okay. So now the autograft is usually own body. Auto is sourced from the own body, especially skin graft. Especially skin grafts are common, own body. Allograft is the most common one. The most commonly which one we are using, they'll ask allograft. So that means all your kidney, heart, everything, kidney, heart, kidney, whatever comes, liver, everything, allograft. That means auto is from own body, allograft is from the same species, okay? Another person but the same species. Allo means another. Iso means, it's a twins, identical twins. We're talking about the identical twins. Anything with identical twins, isograph. Xeno is another species. Xeno is totally another species. You know this one, okay? So anything can be asked. So here, so severe reaction occurs in which? Of course, your Xeno. Xeno is totally another species. So highest amount of rejection happen with xenograft only, okay? It's different species. So HLA typing is for, yes, example, this is for matching. For matching the graft matching, we need the HLA. And yeah, so yeah, in HLA, it's located on the chromosome number 6, okay, that you know, chromosome number 6, we are talking about HLA now. HLA typing is very important. HLA, so it's for matching the graft, it's located on 6. Okay, little bit about HLA 1 and 2, HLA 1 and 2, though you know already. I told you to remember, always remember, one cell has one nucleus. One cell has one nucleus. Remember like that. One cell has one nucleus. I mean to say, MH is present in all nucleated cells. All nucleated cell except only two, RBC and sperm. You don't have this one. You don't have MHC in these two. In RBC and sperm, you don't have. RBC and sperm, we don't have. Rest all nucleated cells we have. But was two, you know, Andhra Pradesh, AP is broken into two states, right? It is broken into two states. So I mean to say, it is antigen presenting cell. It's present in the antigen presenting cells. All the antigen presenting cells are MHC2 or HLA, human leukocyte or major histocompatibility call. They are basically, these molecules are helping in the antigen presenting. You know that, okay? These molecules help in the presenting the antigen along with the antigen presenting cell. These molecules, they present it to the cells, the lymphocyte cells for further action. So this also helping in the matching. During graft matching is very important, prevent the cross reaction. So all nuclear cell APC, fine. Then what else? So this is basically that's what this usually due to the endogenous antigen. It usually works with the endogenous antigens, especially viruses. We're talking about viruses. Here it is exogenous. It deals with the exogenous antigen, that is your bacteria. That's all. This is two important things you should know. Okay. So not forget it. Okay. All nucleated cells have MHC and the MHC2. This is only I want to stress here, nothing else. Okay, fine. Next, antigen antibody reaction. So when you talk about the antigen antibody reaction, you know what we have. Your different agglutination, precipitation, neutralization, also complement fixation test you can add. These are the common reactions. So the type of antigen is very important for precipitation and for agglutination. For precipitation agglutination, this is also important question. Remember SP, sub-inspector of police. So that means here we are using soluble. For precipitation, we are using soluble antigen. For agglutination, we are using insoluble. AIM, shortcut is AIM, okay, AIM, insoluble antigen, and M because IgM has important role here, okay, IgM. Soluble antigen, the type of antigen in precipitation is soluble, SP, sub-inspector of police, and for agglutination, AIM, insoluble, IgM, that's all, okay, this only. Now, next we have the zone, this is the zone, this is a prozone, whatever given here, this picture you're seeing, no? So this is a prozone, this is a zone of equivalence, and this is a post zone. So how to remember, sir? Everybody goes to gym to get a pro body, right? Everybody wants to have a body like a pro, okay, like a pro actor. So pro means body. So I'm saying antibody. When in pro zone, you will have the antibody increased, okay? Pro means body, antibody. Okay, zone of equivalence, antigen will be, number of antigen will be equal to antibody, number of antigen will be equal to antibody. In post zone, antigen will be more than the antibody, and because of this only what we have the lot of negative, okay, false positive, false negative reactions, false negative, false positive reactions are because of this post zone, pre-zone and post zone only. That's what we do dilation anyway. So main things in zone of equivalence only you get a proper reaction. If you want a proper reaction, there should be the antigen antibody should be combined. Okay, that's all. This much only I want to say. So they usually ask the question in the pro zone is a frequently asked question. They many times repeated is pro zone, what is high? So in pro zone, what is high? Your antibody is high. Pro means pro body. Remember, like a pro body. That's all. Okay, fine. Blotting technique we already spoke, not much to be done. Southern blot again writing DNA, northern blot RNA. You don't need to write it. We already did. Western blot for protein we said. And only thing is here, screening for HIV. Directly they came for screening for HIV. You know that for HIV screening what we use? We can use ELISA. We can use the immunochromatographic test, right? The CART test, right? Like this CART test or ELISA, or here tried out. Tried out is tried out. it will be like you have both HIV 1 and 2 will be there, try dot. Okay, two things will be there, and then that's called try dot. Another one is your comb test. Now that comb, you have an antigen antibody detecting like this, that will be marked like this, called Combs test. Okay, Combs. These are the 4 screening tests for HIV. Okay, immunochromatographic, all are rapid and screening, initial screening. For confirmatory, what we do? PCR. PCR we do RT-PCR. That's the reverse transcriptase PCR we are doing to confirmatory test. Okay, that's the main thing. You know, the as early 12th day itself it comes positive. 12th day itself it shows positive. Monitoring the treatment, again PCR. So you will check the copies. You will check the viral copies. Not anymore. CD4 is not. CD4 counting is not anymore monitoring the treatment. Nowadays PCR is the best one. That's all. Okay. This is first thing. And of course, Western blot is supplementary. When you talk about the Western blot, it is only the supplementary test. If you don't do also, not a problem. Okay, many places they're not doing only. Okay, they're not doing. So main is this one. First you do screening, and accordingly, if any two of the tests comes positive, you give positive. Okay, if you have further any doubt or whatever, or you want to really confirm, then you go for PCR. Okay, in India, according to Indian this thing, government it's not recommended. Okay, but it depends upon the condition. Okay, fine. Next. Gram-negative endocarditis. Gram-negative endocarditis, these are the bacteria. So these are the HASSIC group. We call it as simply called HASSIC group. I'm sorry. Here it is the HASSIC. H-A-C-E-K. So HASSIC, we call simply HASSIC group. HASSIC group bacteria are one of the causes for what? For the culture negative infective endocarditis. That means your culture will come negative. You do a blood culture will come negative, but actually the patient is having this bacteria. Blood culture will be negative, but the patient is having infective endocarditis. That only. Okay. So these are the bacteria. Haemophilus, actinobacillus. One thing here is it's actinobacillus. It's not Acinetobacter. In option they'll give Acinetobacter. That is except. Not Acinetobacter will not come here. That one remember. Cordiobacterium echinella is basically human bite. In human bite, commonly encountered organism is Echinella, Kingella, Kingi. It's not important. Echinella. These are the common one. Okay, when you talk about infective gram-negative, but when you talk about most common cause, when you talk about the most common cause of acute infective endocarditis native overall, you know this because we're talking about acute native. So when you talk about overall most common cause of acute native overall, very good, Joseph. And you're talking about Staphylococcus aureus, Staph aureus. Good. What about subacute? Whenever you talk about subacute, you will be thinking about your Staphylococcus epidermidis. Epidermidis is more common than your Staphylococcus viridans. Both are Streptococcus viridans. Streptococcus viridans. We talk. Yeah. So prosthetic valve comes early. It is epidermidis. E for epidermidis. If it is late, then it goes to the Streptococcus viridans again. These are few things which you have to know before the exam, right? Yeah. Commonly asked question. Yes. Now, we are going to a little bit of jumping. 11:15 is the break time, but we didn't complete, yeah. 11:15 we'll have a break. Okay, before that maximum, how much finishing, that is better. Whatever pending, we'll do after that. No need to worry. Okay, now come. So next is a hemolysis. Hemolysis, you know, always the blood agar is how much? 5% cheap blood agar only we use. That's fine. So you have a hemolysis 3 types: beta, alpha, gamma. Beta, alpha, gamma. So always don't confuse with the complete. Beta is always complete, not alpha. You go in order beta. Okay. I told when we have beta money, you are complete. Your life is complete. Beta, when you have a beta or money, your life is complete. Okay, like that. Alpha means always partial. They say alpha, but they are partial. I told you. Gamma means no hemolysis at all. No hemolysis at all. Now go for beta. So complete hemolysis, there's only two: Group A and Group B. Group A and Group B. So group A is your Streptococcus pyogenes, no to confuse. B is your Agartala boy, Agalactiae. Group B, Agartala boy. B for boy, Agalactiae. Agartala, right. Alpha, two things: Streptococcus pneumoniae and your Virat Kohli viru, right? Viridans. He is an alpha male, right? But partial, like that. This is last one is Enterococcus. Enterococcus is your gamma. That's all. These are the 4 hemolytic properties. Now, very important for streptococcal classification, this is brown classification, but Streptococcus, especially your Streptococcus pyogenes, we have 2 important classification. If you remember, they are frequently asked. One is based on your carbohydrate, other one is based on the M protein. Based on the carbohydrate, you know that is called Lancefield classification. CC is there. M protein, I told, remember, GM mota. So it is Griffith. Griffith, okay, Griffith, Griffith, frequently asked question, Griffith, Lancefield. So based on the Lancefield, we have from A to V, we have, okay, A to V, except I and J, except I and J is not there, okay. Whereas in Griffith again, he classified the group A into more than 100 serotypes, more than 100 serotypes, that's all, okay, this much only. Two classifications, Lancefield and Griffith. Lancefield and Griffith, they asked few times, they asked this question, okay. So let's be ready for that one, not to miss this one, okay. Yeah, now that's all. Now rest all easy only. We have the same thing discussed. Bacterial motility, different type of motility, but when you talk about a swarming motility, the classic one is Proteus. But again I told Proteus, Serratia, Vibria parahemolyticus, and then of course your Clostridium tetani. But usually they ask Proteus only. Okay, Proteus only. This is the Proteus one. So motility inhibition increase in the concentration 6%. We already spoke about, not to repeat. Either you increase the concentration of the agar to 6%, or you add the bile salt, or you add the ethanol, or you add the boric acid, or you add the ethanol, yeah, this much only, main thing. Okay, ethanol, bile salt, increase all these things, then definitely there will be inhibition of the swarming motility. Okay, so these things, same methods, swarming method inhibition, so these only. Increase the concentration of agar, bile salt, ethanol, boric acid, that's it. Charcoal also, you can add charcoal also. Charcoal also you can add to inhibit the motility, that's all. Okay, yes, yeah. And you know one Proteus, that important phenomena is Dine's phenomena, that is basically when they are same species, the swarming will collide with each other. If they're different, they not collide. But you remember P for phenomena, P for Proteus. That's all. Proteus. Okay. Dine's phenomena. Dine's method is for mycoplasma. Carbide temperament. What's it in VSV 16? Yeah, Sabri. That is classification based on your carbohydrate. You classify your Streptococcus group A, Streptococcus pyogenes, as two classification. One is based on your carbohydrate, other one is based on your M protein, okay, carbohydrate and M protein. So carbohydrate classification is called Lancefield classification, whereas your M protein classification is called GM Motas, G for Griffith. Griffith is based on M protein, that's all. Okay, that much. Right, okay. So now exotoxin effect. So we have come to the exotoxin effect. Exotoxin here, the toxin, one of the exotoxin, next one, 68. Exotoxin is already pictures given, cholera toxin, everything is important here. First of all, you can see infected dose, you know, it should be more than 10 to the power 6. You need highest 10 to the power 6 bacilli per ml of whatever, water or whatever. Okay, first one. Role of gastric, you know, hypochlorhydria is the main risk factor. Hypochlorhydria. Hypochlorhydria means it's you know, that is because of antacid, excess antacid used or PPA used. What happened? Your HCl production will go down, and that is the main thing for alkaline environment where your Vibrio can grow. Okay, hypochlorhydria, you know that. Effect of cholera, everything is important here. Cholera mechanism is, if you know, cholera toxin, it has A site and B. A and B, two site it has. B for binding. After binding, what it binds? The first thing it binds is your GM motas, GM1 ganglioside receptor. I told you, Vibha is a rich girl. She has GM car. She has a GM Motors, popular one, US popular one, right, in UK. GM Motors. And for GM Motors, whatever, that is basically ganglioside receptor. That is ganglioside receptors. And then from there, she goes to which mechanism? Cyclic AMP. Remember, right? C for cholera, A for anthrax. I'm not going to repeat. E, M if you tilt E equal, P for pertussis. Not going to talk this here at all. We don't have time. And then what happened? It causes the diarrhea. It causes what? Watery diarrhea. Watery rice water diarrhea. Rice water diarrhea. No any inflammation. Rice water diarrhea. Rice water diarrhea. Okay, you know, no inflammation. The idea is no inflammation in Vibrio. Just water is going out, patient get dehydration, you have to treat that. Okay, so effect of cholera toxin, same only. Okay, it's the same thing here. I mentioned treatment, you know, it's basically ORS. If not going, you add, of course, doxycycline. That's it, nothing much here. Okay, yeah. You know this. Vibrio control is fingertips. No, alkaline pulmonator, C water, Venkatraman and Ramakrishnan medium, TCBS medium, all that Vibha story we know. Shooting star motility, darting motility, those, you know, I'm not going to touch it. Okay, that may be in vital capsule, few of the things we have written, we'll go there. Herpes. Now come to the herpes group, you know this. Herpes means they are here herpes, we're talking about HSV 1 and 2 we are talking. So the latent site of trigeminal ganglion, usually HSV remains in trigeminal ganglion, and this S for, if you forgot also, S is second, okay, S is second. So S for sacral ganglion, however you want. So in HS1, the vesicle seen above the waist, anything above the waist part is your HSV1. Anything below the waist, that is genital. When you talk about below waist, we are talking about the genital ulcer, genital ulcer, one of the most common causes your HSV2, you know. Okay, reactivation T becomes what? Whenever patient is having fever or the immunity goes down, especially when HIV patient, the reactivation happens, right? Okay, so fever, immunity go, stress comes, automatically from the ganglion, the virus will travel out and it causes the reactivation. You can get shingles, or if it's herpes zoster shingles, here again the ulcer, genital ulcer, that's the problem. Okay, repeatedly it comes. Whenever the stress happens, the patient once get herpes, it will come again and again. Okay, that's the treatment, same acyclovir. Nothing fancy, right? This is all same only, nothing much to stress. Yeah, next one. HIV stretcher, yeah, HIV stretcher again came, good only. So here what is important? We have 15 minutes. We'll finish before 15 minutes, then we'll have break. Okay, 11:15 we'll have break. So we have three genes. We know envelope, Paul gene, because this is a question I made in my All India exam. So that's what good that they have given here also. I'm very glad. So envelope gene. Envelope gene means something big. You know, it's outermost covering. So something big. So when you talk something big, envelope gene is basically making your 120 and 41 protein. Okay, that's it. Big ones. Envelope means outermost one. Outermost you have 120 and 41. Very easy. Now, what about this pool? Pool, you remember as pool of enzymes. Pool, you remember pool of swimming pool full of enzymes. Okay, pool of enzymes. So which enzyme we're talking? We're talking about protease. We're talking about the reverse transcriptase. We know that we have two single-stranded RNA, reverse transcriptase and integrase. These are the important RIP. Okay, shortcut is RIP. Pool of RIP enzymes. Okay, pool of RIP enzymes. R for reverse transcriptase, I for integrase, P for protease. Okay, it looks small. You can have question from here only. They know how to pull our legs down, so they can ask from here easily. GAG gene. GAG gene, I always told, remember this Lady Gaga. She's almost 39 now, but still she says when she celebrates her birthday, her age is between 17 to 24 only. Okay, that means group 17 and group 24. Just group 17 and group 24 has her age. She never goes old. Like our Sheila auntie, 60 years, she says. Here, same way, Gaga is 70 to 2. She's young. Okay. Remember, these are few tips I'm giving. There is nothing to do with Lady Gaga and Sheila and all. This is for our remembrance before exam. Okay. That's all. Now, the latency. Latency, right? Latency. You see, latency means no any replication, no any. Simply, your virus sleeps during latency. Virus just rests. Okay, it rests very well inside the ganglia. Fine. Long duration of the longer duration of dormancy. That's what they usually remain. They remain latent inside the thing. Usually, cytomegalovirus is the one which has longest latency. But yeah, it can be any virus definitely. Okay, so it remains there and active. That's more herpes group. When you talk about this, we talk about the whole herpes group. Okay, that's all. That's it. So same thing, herpes group, same, everybody remains latent, and when the situation, when the condition goes worse, okay, then these viruses start to produce the symptoms. Viruses produce symptom or disease, produces clinical symptoms. Nothing significant in this side. Latency is latency only. We already know that cytomegalovirus is in the glands, different things. All the herpes simplex, herpes zoster, they like the ganglion, right? The ganglion. And yeah, these are the few things you should know. Now, diarrheal diseases. Diarrheal disease, yeah, viral diarrheal disease is very important. It's worth it. Huh? I know that you guys already thorough with this. So, viral diseases, diarrhea is usually caused by two types of viruses. So, either it should be DNA or RNA. In DNA, only one virus, that is your adenovirus. Adenovirus means it's a combination of diseases. You know that, right? Adenovirus, they have respiratory infection, they have eye infection, and of course, they have GIT diarrhea. Combination of infection, you know, that's a space vehicle. We know that one, space vehicle appearance. RNA has important role. RNA has the most important viruses. Example, the first most common one is your rotavirus. Rotavirus, and other one is your norovirus. Rota and norovirus. Of course, astrovirus also. Astrovirus is not much. Main thing is rota, which is in children. Most common cause of diarrhea in children. Okay, this is the most common cause of diarrhea in children. You know, Nora is a big girl. No? Nora Fatih big girl. So in adult, the most common virus is norovirus only. Adeno is also in children only, but most common is rota. You know that very well, adult. And astrovirus is astro, not that. Astrovirus can affect anyone, both adult and children. Anyway, adult children, nothing much. Children, you know that one. So the vaccine preventable diarrhea disease is only your rotavirus. You know that rota because you have rotavac and rotavirix vaccine. Rotavirix vaccine. These are two vaccines. Both are live oral live vaccine. The children have to receive within 8 months in order to prevent the intussusception, right? Within 6 months, mainly to prevent the intussusception. The side effects of the vaccines are obstruction by intussusception, intestinal obstruction by intussusception. So to prevent it, the vaccine should be given within 8 months itself. Yeah, these are all common stories we have discussed many times. Now, so you know it. So idea is rotavirus NSP4 is nothing. It just acts like an enterotoxin in a bacteria. How like the bacterial enterotoxin, same way this rotavirus NSP4 acts, that's all, it mimics enterotoxin. That's my significant. You know about the rotavirus, that's only main thing. Okay, most common cause of diarrhea in children, rotavirus and rotavirus vaccine, less than 8 months. And of course, the what else left? Yes, that's all. Okay, we have done rotavax and rotavirus, this only, nothing much here. 3 doses, yeah, basically you give 3 doses. That is like 1, 0, 1 and 6. Okay, 0, 1 and 6 months is a common dose. 0, 1 and 6 months. Okay. Yes, malaria. Now go to malaria. Yeah, we'll finish it. It's easy only. This is all you know. So when you go to malaria, first is the infective stage. Infective stage, we have investigated man and mosquito separately. So for man, the infective stage, you know, it is your sporocyte. You kill with the sporocyte, right? You kill the man with a sporocyte, like Gladiator movie or whatever. You kill with a sporocyte. Spore, spear. Remember spore, spear. Okay. For mosquito, it is gametocyte. For mosquito, it is gametocyte. Okay. But in during blood transfusion and all, the infective stage should be trophocyte. If someone is getting during blood transfusion, if he gets malaria, it's very rare. It should be trophocyte. Ideally, it is usually sporocyte. For men is sporocyte only. Okay. That is frequently asked question. Yes. And then the target stage. You know the RBC, Vivek, Vivax and falciparum usually we call. When you talk about Vivek, I told Vivek is a young boy, so young RBC. Vivek is an young boy, so young RBC. Whereas your falciparum is the most dangerous one. I call Mao body. Mao is a Chinese, so everything is dangerous. So they can affect any RBCs. Your falciparum dangerous can affect any RBC, but your Vivek is a young boy. Okay, that is one thing. Now diagnostic change. Diagnostic change is very important. In Plasmodium vivax, you can detect the early trophocyte stage, late trophocyte stage. I'm going in order: early, late, sejoint, and then you will be checking even your gametocyte. Everything will be here, gametocyte. But whereas in your falciparum, repeatedly asked question, you will have ET and gametocyte, but you will not have these two negative. You don't have late trophocyte and sejoint stage. The only reason because here what happened? This parasite, these stage parasite, they stick to blood capillaries. They stick to the blood capillaries or the blood vessels, and they don't come out into the blood. They just stick to that. So that's what in a blood you will never detect. In your wet mode, it's there. We have the late trophocyte and sejoint, but you never seen. That was a previous year INCT question. They told that why in a blood, especially in the falciparum, you don't see the late trophocyte and sejoint, because these two stages, they stick to the blood capillaries in the any organ. They stick there and they don't come to the blood. That's the reason. Okay, only for falciparum. But in Vivek, everything you can see everything in Vivek. That's all. Okay, that's the point. Okay, I'm not going to talk about the bodies and all, because you know Schaffner's body in Vivax, Mauer body in falciparum, and Duffy antigen helps in Vivax entry. These things and all in vital capsule we can see if you have time. So now this main thing is this only. Okay, so next is relapse is another important question. Then relapse is common in where? In your Plasmodium vivax and Plasmodium ovale. Okay, because of which stage? Hypnozoite, and which happens every 3 years once. Okay, 3 years once it can happen. Okay, remember. Plasmodium vivax and ovale, which can happen. So if you have relapse, then you have recrudescence. Recrudescence is basically seen in your Plasmodium falciparum, very dangerous. And why? Drug resistance. Because of drug resistance. So this can happen after treatment. Within 3 weeks, patient can come again with the malaria. Okay. Then if you come again with 3 weeks of malaria, you think about falciparum, it's a recrudescence. But when after 3 years, if it comes, then it is mostly hypnozoite activation. Hypnozoite is a dormant stage in the liver, reactivates. That's it. Okay. So that you know. Now treatment. They have treatment target stage. Okay, treatment targets, remember. All the asexual stage in the RBCs except gamocyte, all the asexual stage means all the trophocyte stage, and we're talking about the sejoint stage. So which is good? Chloroquine. Chloroquine can kill all these stages, which is for, of course, your Plasmodium vivax. We give this one, right? Main treatment. Gametocyte, only for gametocyte you give quinine. Quinine, again, this is for Plasmodium falciparum, malaria, pregnancy ladies. This is the drug of choice. Hypnozoite. Hypnozoite is inside the liver. So to kill that, you give primaquine. Primaquine will kill the hypnozoites in liver. Primaquine. What about both common asexual gametocyte all together killing? Only your ACT. That is not ACT. Artemisinin. Better, right? That's a combination therapy. I'm going to write artemisinin. Okay, artemisinin or your artesunate, whatever, those combinations. That is the one which is powerful for everyone. So that is the drug of choice for your Plasmodium falciparum. Combination therapy, but yeah. For Vivax, it's still chloroquine only, but for other thing, it changes. Okay, for Plasmodium falciparum, pregnancy quinine, and in adult generally artemisinin combination you can give ACT. Okay, rest of the drugs you will be studying PSM and nothing. Okay, right. Now the last thing which already spoke about it. Okay, the 5 minutes is there. We'll finish this and we can take a break. This is all discussed only, nothing special here. You are going to repeat now. Auto-infection, we already told that auto-infection means chest. Shortcut is chest. Yeah, we already just spoke. Chest. C for Cryptosporidium, H nana, Enterobacter vermicularis, Strongyloides, and T for your Taenia solium cyst stage, cysticercus stage. Okay, you know that. Next, what about nocturnal period parentage? That's the characteristic feature. So that is basically this is we're talking about here. Enterobius vermicularis. The Enterobius vermicularis. Vermicularis. See the egg now, planar convex. We call it as D shape, planar convex. So as I told, the child cry at night time, dada, mama, 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 mama because mebendazole, dada because the shape is D, planar convex egg. This and all very characteristic. Common in children, definitely yes. Okay, children will become perianal, actually nocturnal. So what about the cecum? Cecum and appendix where the adult worm lives. From there only this female worm at night time it goes and lays egg in the perianal region, and that's what the child has the itching in the perianal region. NIH swab or squat swab you do, and then you check for this X. Okay, nothing special here. Treatment is mebendazole. Okay, we spoke that. I'm not writing it again. So now germ tube test again. Superficial mycosis, same thing. We're talking about we already spoke everything. For Candida only again. Okay, we just spoke. So germ test means it's for one species. For Candida, you do for Candida albicans. SDA growth, I told it looks like a yeast. White color yeast. Yeast is like a paste like growth you see. In cornmeal agar if you put, there's a special thing characteristic for your Candida is chlamydophore, C for C, chlamydophore. Cornmeal agar based on the color you can do speciation. Speciation, okay, speciation for Candida speciation, different species you can candidate. The most important nowadays they can ask you is drug resistant. Only one thing which is dangerous here, that is your Candida auris. The most drug resistant, almost no drug is working, auris, and recently a threat. They can ask you. It's not aureus, it's not glabrata, it's not parapsilosis, different species you have in Candida. So the one species which you have to be very dangerous, auris. Okay, that question they can ask you. Most resistant. Okay, that's all. And this is a Raynaud's-Brody phenomenon. You're seeing germ-cell tumors. Raynaud, we already wrote it. I'm not striking it again. Yes. Now this one. Once again, they have given there. Yeah, 3 minutes. Then we are having break. Okay. Yes. Look at this. The bacterial agent demonstrated here. It can be anything. It can be anything. See, this is a again repeated UV. That is we're using UV. That means it's a fluorescent. Fluorescent microscopy. The bacteria which we spoke is your auramine rhodamine. That is your auramine rhodamine TB. Auramine rhodamine. So it is for TB. Same thing they're repeating again and again. I don't know. It's a Mycobacterium TB. So for Mycobacterium TB, and for viral we have only for viral. Many viruses you can do. You can use for rabies also. We can use. Especially if you remember, once again, that one is your direct fluorescent antibody test we call DFA. Okay, many viruses you can use. That is especially for rabies. One example is this one. You can remember. Okay, fungal we told all calcofluor white. Calcofluor white for all the fungus. Fungus are white in color. Parasite we were talking about malaria. Malaria means I told please give what? Acridine orange. Please give orange to a patient. Okay. And especially there is a name for this called Kawamoto technique. For malaria, we call it as Kawamoto technique. You give the patient moto with malaria orange, remember like that. Okay, that's easy. That's all. Okay, flumeter thing. Yes, now the last one. The last one. Yeah, and then 1 minute, this is finished. Okay, look at this. So, antigen presenting cell, we have many things. The shortcut is again, I'm repeating bad microbe, right? We call it as bad microbe. Bad microbe is the right one. B for B cells. D for dendritic, M for macrophage. That's all. Okay, these are 3 antigen thing. And AP markers for antigen presenting marker we just spoke. I told Andhra Pradesh break into 2 states. No? It broke into 2 states. So HLA is for basically for HLA2 is for the antigen presenting cells. We know that one. Okay, bacterial virus same thing only. Just it presents the antigen. You can see here, this is the antigen if it's there, this is the antigen or anything. It goes inside, it goes presented inside the macrophage, and inside the macrophage, you have a phagolysosome formation and killing this thing. Fungus calcofluor white. Sabri, fungus diagnosis is calcofluor white. Right? Okay. So bacterial version same only. That's basically they form a phagolysosome. And then the granules are released and the bacteria and the antigen or whatever that is getting gets killed. Okay. So I'm not going to repeat too much there. That's all. this much only. Okay, next is the genetic. So then only 12 slides are remaining, and after that we'll go for the vital capsule. Okay, so I'm going to give a break, but yeah, so we will come, we'll gather at 11:30. Doctors, 11:30. So I'll also go and come, and after that, any doubts we can talk. Okay, Sabri, you can write the questions there, no problem. But after 15 minutes, I'll come